What if the dry eyes, joint aches, or fatigue you've been brushing off as just getting older were actually early signs of a serious autoimmune disease? Sjögren's syndrome affects an estimated 4 million Americans, yet most people go years without a diagnosis, on average, nearly 4 years. That's 4 years of silent damage to your eyes, your mouth, your nerves, even your lungs and kidneys. And here's the real danger: the early symptoms are often so subtle, they're dismissed as minor annoyances, or chalked up to stress, menopause, or aging. But left untreated, Sjögren's can lead to permanent organ damage, chronic pain, and even increase your risk for lymphoma. In this video, we'll uncover 9 symptoms you should never ignore, explain why they happen, and show you exactly what to do next. If you or someone you love is living with unexplained symptoms, this could be the turning point. Number 1. Persistent dry eyes, keratoconjunctivitis sicca. Persistent dry eyes, keratoconjunctivitis sicca, is often one of the earliest and most noticeable symptoms of Sjögren's syndrome, but it's also one of the most frequently ignored. Many people assume their dry, irritated eyes are just a result of staring at screens too long, allergies, or the natural effects of aging. But in Sjögren's, the issue runs much deeper. This condition occurs when the immune system mistakenly attacks the lacrimal glands, which are responsible for producing tears. The result? A chronic lack of moisture in the eyes that doesn't improve with rest or over-the-counter drops. The sensation can feel like grit, sand, or a burning pain in the eyes, day after day. You might wake up with sticky eyelids, or find it difficult to keep your eyes open in brightly lit environments. Light sensitivity, blurred vision, and frequent eye redness are also common. This isn't just uncomfortable, it can interfere with reading, driving, or even watching TV. So what can you do? The first step is using preservative-free artificial tears, ideally 4 to 6 times a day. These offer temporary relief and reduce friction on the eye's surface. In more severe cases, your doctor may recommend moisture chamber glasses, which trap humidity around the eyes, or using a humidifier indoors to maintain consistent moisture levels. For longer-term management, an ophthalmologist might prescribe cyclosporin eye drops, such as Restasis or Sequa. These help reduce inflammation in the lacrimal glands and may gradually increase natural tear production over time. To confirm the diagnosis, your eye specialist may perform a Schirmer's test, where small strips of paper are placed under your eyelids to measure tear production. It's a quick, painless test, but an important one that could uncover a more serious underlying issue. Dry eyes might seem like a minor inconvenience, but when they persist, they could be your body's first signal of an autoimmune disease. Taking action early can help you preserve your vision and take control of your overall health. Number 2. Joint and muscle pain. Joint and muscle pain is another major red flag in Sjögren's syndrome, and one that's often misunderstood or brushed off as a normal part of aging. But here's the truth: this pain is not just about wear and tear. In people with Sjögren's, the immune system triggers chronic inflammation that targets joints and surrounding tissues, especially in a symmetrical pattern, meaning both hands, both knees, both wrists often hurt in unison. That's a key difference from typical joint pain due to overuse or injury, which usually affects one side more than the other. What makes it even more challenging is that standard imaging tests like X-rays often appear normal, especially in the early stages. So patients may be told there's nothing wrong, even when their daily life is being disrupted by pain, stiffness, and swelling. Morning stiffness lasting more than an hour is particularly common, and many people find their joints feel locked or heavy upon waking, only improving slowly with movement. Thankfully, there are ways to manage this. Start your day with warm compresses or a warm shower to gently loosen the joints. Incorporating light stretching or yoga can also ease stiffness and maintain flexibility. Diet plays a huge role too. Focus on anti-inflammatory foods like turmeric, with black pepper to boost absorption, omega-3 rich foods like flaxseed or salmon, and green tea, which contains compounds that help reduce inflammation. If your joint pain persists or worsens, it's crucial to see a rheumatologist, a specialist in autoimmune and joint conditions. They can run more advanced tests and may prescribe medications like hydroxychloroquine, Plaquenil, a disease-modifying drug that helps control immune activity and reduce flare-ups without the harsh side effects of steroids. In Sjögren's, joint pain is more than discomfort, it's a sign your body's immune system is out of balance. Addressing it early can help prevent long-term damage and significantly improve your quality of life. Number 3. Nerve problems, neuropathy and brain fog. Nerve problems are one of the more unsettling and often misunderstood symptoms of Sjögren's syndrome. They can show up subtly at first, maybe a slight tingling in your fingertips, a numbness in your toes, or even a strange burning sensation that seems to come out of nowhere. This is known as peripheral neuropathy, and in Sjögren's, it happens when the immune system mistakenly targets the nerves outside the brain and spinal cord, disrupting their normal function. What makes it more concerning is that these symptoms often follow a glove and stocking pattern, starting in the hands and feet and sometimes spreading upward. But it doesn't stop there. Many people with Sjögren's also experience brain fog, a frustrating clouding of thought that can make it hard to focus, remember names, or find the right words during conversation. These cognitive issues are not just in your head, they're real, and they can deeply impact your work, relationships, and confidence. In fact, some cases mimic multiple sclerosis, MS, so closely that misdiagnosis is common without thorough neurological testing. Fortunately, there are steps you can take. Start by testing for vitamin B12 and D deficiencies, as these are frequently low in people with autoimmune conditions and can worsen nerve symptoms. Supplements like B-complex vitamins and magnesium can support nerve health, while gentle daily movement, like walking, and warm baths can help stimulate circulation. To manage brain fog, reduce refined sugars and processed foods that drive inflammation. Make sleep a priority, getting at least 7 to 8 hours a night, and focus on stress reduction techniques like deep breathing or mindfulness. If your symptoms persist, a neurologist may suggest nerve conduction studies or MRI scans to assess nerve damage and rule out other conditions like MS. The sooner you investigate, the better. Neuropathy and cognitive issues may feel invisible, but they are powerful indicators that your immune system needs attention, and early care can make a world of difference. Number 4. Fatigue and poor exercise recovery. Fatigue is one of the most common and debilitating symptoms of Sjögren's syndrome, but it's not your typical tiredness. This is a deep, bone-crushing exhaustion that doesn't go away with rest. It's often the result of chronic inflammation constantly working in the background, quietly draining your energy. Even light activity, like folding laundry, grocery shopping, or walking a few blocks, can lead to post-exertional malaise, where you feel completely wiped out for hours or even days afterward. Many people try to push through it, especially on days when they feel a bit better. But this often backfires, leading to crashes and longer recovery periods. That's why one of the most important tools for managing this type of fatigue is pacing, balancing activity and rest so you don't overdo it on your good days. Think of your energy like a battery that needs careful budgeting. Low-impact exercises like Tai Chi, water aerobics, or gentle stretching can help maintain strength and circulation without triggering flare-ups. But the key is to keep these sessions short and consistent. 5 to 15 minutes may be plenty, depending on how you feel. Your daily routine can also play a powerful role in managing fatigue. Adopt an anti-inflammatory diet rich in leafy greens, berries, fatty fish, turmeric, and healthy fats like olive oil. At the same time, reduce processed foods, sugar, and alcohol, which can spike inflammation. Techniques like deep breathing, meditation, or progressive muscle relaxation can help calm your nervous system and improve sleep quality, another crucial factor in recovery. Keeping a daily symptom journal can be incredibly useful. By tracking what you eat, how much you move, how well you sleep, and how you feel each day, you can start to spot patterns and avoid the triggers that make your fatigue worse. With the right adjustments, it's possible to regain some control over your energy and protect your long-term quality of life. Number 5. Lung involvement, dry cough, breathlessness. Lung involvement is one of the lesser-known but potentially serious complications of Sjögren's syndrome, and it's easy to miss. You might notice a persistent dry cough that doesn't go away, even without a cold. Or maybe you feel short of breath doing everyday activities like climbing stairs or walking short distances. Some people even experience pleurisy, a sharp, stabbing chest pain that worsens when taking deep breaths. These symptoms aren't just annoying, they could be signs of interstitial lung disease, ILD, or bronchiolitis, both of which involve inflammation and scarring of the lung tissues and airways. What makes this so tricky is that lung symptoms often develop slowly and subtly, and many people assume it's just aging or being out of shape. But with Sjögren's, the immune system attacks not only glands but also lung tissue, potentially reducing your lung capacity over time. If you're experiencing any of these signs, it's important to get evaluated. Your doctor may recommend pulmonary function tests, PFTs, to measure how well your lungs are working, and a high-resolution CT, HRCT, scan to look for signs of scarring or inflammation in the lung tissue. These tools are key to catching problems early, before they become more difficult to manage. There are also things you can do at home to help protect your lungs. If you smoke, quitting immediately is non-negotiable. Smoking dramatically accelerates lung damage in autoimmune diseases. Also, try to avoid cold or dry air, which can irritate sensitive lungs. Using a humidifier indoors and steering clear of chemical irritants like cleaning fumes or strong perfumes can also help ease symptoms. Depending on the severity, your doctor or pulmonologist may prescribe corticosteroids or immunosuppressant medications to calm the inflammation and prevent further damage. Your lungs may not always be the first place you expect Sjögren's to show up, but when they are affected, early recognition and treatment can make a real difference in how well you breathe and how well you live. Number 6. Kidney dysfunction. Kidney dysfunction in Sjögren's syndrome often flies under the radar, but it can have a serious impact on long-term health if not caught early. The most common form is interstitial nephritis, a silent inflammation that damages the spaces between kidney tubules over time. What makes this so dangerous is that it typically develops without obvious symptoms at first. By the time signs do appear, such as frequent nighttime urination, electrolyte imbalances, or the formation of kidney stones, significant damage may already be underway. Many people mistake these symptoms for other issues, like drinking too much water before bed or simply aging. But in the context of Sjögren's, they may signal a deeper problem with how the kidneys are processing and filtering waste, acids, and minerals. To stay ahead of this, regular urine tests, especially looking for proteinuria, protein in the urine, along with blood panels that measure creatinine, potassium, and bicarbonate levels are essential. These tests can detect subtle kidney issues long before they become serious. One key tip for protecting kidney health is to stay well hydrated, but without overdoing it. At the same time, avoid nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, which can further stress the kidneys, especially in autoimmune patients. Diet can also play a supporting role. Talk to a nephrologist about adopting an alkaline-based diet that includes potassium-rich foods like leafy greens, bananas, and avocados, as long as your potassium levels are stable. This may help buffer acid buildup and reduce kidney workload. Also, watch for signs of conditions like renal tubular acidosis, RTA, which causes fatigue, muscle weakness, and abnormal blood acidity, or nephrogenic diabetes insipidus, which leads to excessive thirst and urination. Both are linked to Sjögren's and require medical attention. Your kidneys work silently in the background every day, but when Sjögren's strikes, listening to those small signals and taking action early can make all the difference. Number 7. Blood abnormalities, anemia, low WBC, lymphoma risk. Blood abnormalities in Sjögren's syndrome are more than just lab results. They can be powerful warning signs that something deeper is happening inside the body. Chronic inflammation from the immune system can suppress bone marrow function, leading to a drop in red blood cells, anemia, white blood cells, leukopenia, and even platelets, thrombocytopenia. This isn't just a numbers game. Each of these cells plays a critical role in your overall health. Anemia can cause fatigue, weakness, and shortness of breath. Low white blood cells mean your body has less defense against infections, and low platelets can lead to easy bruising or prolonged bleeding. Even more concerning is the significantly elevated risk of non-Hodgkin lymphoma, particularly malt lymphoma, in people with Sjögren's. In fact, the risk is estimated to be up to 44 times higher than in the general population. This makes it absolutely essential to pay attention to red flags such as persistent swelling in salivary or lymph glands, unexplained weight loss, night sweats, or lingering fatigue. These are not symptoms to ignore. Routine blood work is key to monitoring your status. Ask your doctor for a complete blood count, CBC, immunoglobulin levels, and inflammatory markers like ESR and CRP. These tests help detect subtle shifts in your immune activity and catch complications early. If you're consistently dealing with infections or catching every cold that comes your way, it may be due to low neutrophils, which weakens your immune defenses. Don't hesitate to bring this up with your doctor, especially if you're also experiencing swollen lymph nodes or unusual fatigue. In more advanced cases, a hematologist may get involved to monitor or treat abnormalities. Treatments may include immunosuppressants to calm overactive immune activity or even targeted therapies if lymphoma becomes a concern. Your blood tells a story, don't ignore the chapters. With regular testing and close monitoring, you can catch these complications early and stay one step ahead of Sjögren's. Number 8. Raynaud's phenomenon and circulatory changes. Raynaud's phenomenon is a striking, and often startling, circulatory symptom that can occur with Sjögren's syndrome. It happens when small blood vessels in your fingers or toes suddenly spasm, usually in response to cold temperatures or emotional stress. The result? Your fingers may turn white, then blue, and finally red as blood flow returns, often accompanied by tingling, numbness, or pain. While the color changes might seem harmless, they're actually signaling an underlying issue with blood vessel function and circulation. This condition can make simple tasks, like grabbing groceries from the freezer or stepping outside on a chilly morning, suddenly uncomfortable or even painful. In people with Sjögren's, Raynaud's often shows up alongside other symptoms and should be taken seriously as a sign of systemic involvement. Thankfully, there are ways to manage it. First and foremost, keep your hands and feet warm at all times. Thermal gloves, thick socks, and hand warmers can make a huge difference. Even small temperature shifts can trigger an episode, so it's worth being prepared, especially in colder months. Lifestyle adjustments also help. Avoid caffeine and nicotine, both of which constrict blood vessels and can make symptoms worse. Stress is another trigger, so practicing relaxation techniques, like breathing exercises, meditation, or light stretching, can reduce both stress and flare-ups. For more persistent or severe cases, doctors may recommend calcium channel blockers, a type of medication that relaxes blood vessels and improves circulation. These can be especially helpful if your symptoms are frequent or interfering with daily life. Finally, incorporate gentle hand exercises into your routine. Even basic movements like squeezing a stress ball or opening and closing your fists can help stimulate circulation and keep your hands more responsive. Raynaud's might seem like a surface-level issue, but it's often a deeper reflection of immune system dysfunction. Recognizing and managing it early can improve both your comfort and your long-term vascular health. Number 9. Chronic dry mouth, xerostomia. Chronic dry mouth, xerostomia, is another hallmark symptom of Sjögren's syndrome, and like dry eyes, it's often overlooked or misattributed to aging, medications, or dehydration. But in Sjögren's, the root cause is autoimmune. The body's immune system attacks the salivary glands, dramatically reducing the production of saliva. And saliva is more important than most people realize. Without enough saliva, even simple tasks like speaking, chewing, or swallowing can become difficult and uncomfortable. Many people with Sjögren's find themselves constantly sipping water, especially during meals or conversations. Dry foods like crackers or toast may feel almost impossible to eat without drinking something alongside them. Over time, this constant dryness can lead to more serious complications, such as bad breath, an increased risk of tooth decay, and oral thrush, a fungal infection that thrives in dry, unbalanced environments. Managing dry mouth starts with a few practical daily habits. First, sip water frequently throughout the day, but avoid alcohol, caffeine, or sugary beverages, which can make dryness worse. Sugar-free xylitol gum or lozenges are great tools for stimulating the remaining salivary flow and helping prevent cavities. Just be sure to avoid anything with sugar, which can feed harmful oral bacteria. You can also help restore oral balance by rinsing your mouth with a mixture of baking soda and water. This helps neutralize acids and supports a healthier pH in the mouth. A simple rinse of 1/2 teaspoon baking soda in 1 cup of warm water a few times a day can make a big difference. It's also crucial to see your dentist regularly, as they may detect early signs of damage even before you notice symptoms. If dryness becomes severe, a doctor may prescribe saliva-stimulating medications like pilocarpine or cevimeline, which can offer more lasting relief by activating the salivary glands. Dry mouth is not just an inconvenience, it's a sign your immune system may be under attack. By acting early and treating it consistently, you can protect your teeth, gums, and overall well-being. If you recognize 2 or more of these symptoms, like dry eyes, chronic fatigue, numbness, or joint pain, don't just write them off as getting older. These may be early warning signs of Sjögren's syndrome, a serious autoimmune disease that often goes undiagnosed for years. The sooner you catch it, the better your chances of preventing long-term complications like nerve damage, organ involvement, or even lymphoma. Listening to your body, and speaking up when something feels off, can truly be life-saving. Early diagnosis means earlier treatment, better management, and a much higher quality of life. So take what you've learned today seriously. It might be the most important health step you take this year. Which symptom surprised you the most? Comment below. And don't forget to like, share, and subscribe for more vital health updates that could protect your future.